2020 has been an extraordinary period for all of us, but perhaps most markedly for patients experiencing mental health problems. My name is Andy Blackwell. I'm the Chief Scientific Officer of IESO Digital Health, and I'm joined today by Dr. Anna Catarino, our Principal Scientist, who's been studying the COVID-related data. For those of you that don't know us, we are a high-volume provider of telehealth care for depression and anxiety disorders. We deliver one-to-one CBT over the internet using both synchronous and asynchronous communication. We record clinical outcome at every session so that we can learn. And we also apply some advanced deep learning technology to enable us to quality control the actual therapy content. That's really important for knowledge creation and translation into changes in clinical practice. We've delivered about 300,000 hours of therapy to date. We're delivering about 700 hours of therapy every evening. So it's just a tremendous opportunity to learn what we can about what's working and what's not. So we'll talk today about several methodologies. The principal one is the use of recurrent neural networks to analyze therapy content. And you can read about this in the JAMA psychiatry paper referenced below, and we'll put that on the website. Essentially, we have been able to tag or codify a large volume of therapy transcripts and train a deep neural network to be able to automatically detect clinical events as they occur. And then we can look at that, the chemistry of a therapy session, to find out what's working and what's not, and hopefully improve the care that's being delivered. And we'll be using that technology for this analysis of the COVID period in the first half of 2020. So just to remind ourselves of the timeline, I'm sure we're all very familiar with these graphs. In the UK, the end of January saw the first 2 UK cases. The end of February saw the first British death. In the early part of March, we saw the first death from coronavirus on UK soil. And on the 26th of March, the lockdown regulations began. And that period of time, that lockdown phase, is really central to some of the observations that we'll speak about today. So we use the deep learning technology to analyze the content, the language of therapy, both at assessment and during the sessions themselves. So we're going to start with the clinical presentation of the patients and essentially the moments when they tell us what's bringing them to therapy and what the problems that they are experiencing and the content of that interaction. So Anna, maybe I could hand to you to talk about what we've observed in the worries that patients are reporting at presentation through this period.
Yes, of course. So what we see in this graph is a mention of COVID-19, coronavirus, or related terms in the patient's self-assessment questionnaire. So as you were saying, Andy, the questionnaires that the patient fill out when they register with our service, in where they describe the reasons bringing them to therapy. And what we see around early to mid-March is a sharp increase in the mention of COVID-19 in the self-assessment questionnaire, very much in line with the sharp rise in COVID-19 cases in the UK. But what we have seen since lockdown is a sustained rate of COVID-19 related terms in patient self-assessment questionnaires. Around about a third of patients mention COVID-19 in their self-assessment. And this could be because it's something that is bringing them to therapy, or just because it's a theme that is dominating the world news and people's lives at the moment. But nevertheless, I think this shows an interesting trend that people are still talking about COVID-19 when they're talking about their mental health as well. And this may be an important sign of the role of the situation we are living in on people's mental health.
And it's really striking, isn't it? I think just as I look at the last graph, which is we're seeing the reduction in the infection rates. Here, when people are reporting the difficulties they're experiencing, we're seeing that really endure over this last period. So it doesn't seem to be following the infection rate trend, at least. So we'll need to be keeping a close eye on that for the rest of the year to see how it seems to have a more persistent impact on people's mental health presentation. So now let's talk about the therapy sessions themselves. And we have the ability to analyze the content, including the expressed worries of the patients. So let's look at those and contrast the virus-related worries to the normal worries people experience when presenting for CBT.
Yes, so this graph shows us the worry themes that people are bringing to therapy during the therapy session. So when people mention worries, what kind of things are they worried about? Basically, this is what this graph shows. And you see that family worries at the higher end, about 40% of all worries are around family, which makes sense, you know, relationships and so on. And we have some financial worries, about 5% of worries are around financial worries. And what we see around March time is a sharp increase in worries related to viruses, which were basically non-existent before then. But what we're seeing now is that about 10 to 15% of all worries that are showing up in sessions are about viruses. So it shows that this situation is playing an active role in people's anxieties and how they are feeling at the moment. And again, we saw an increase around lockdown, but it hasn't really decreased with time. So this is something that is still playing in people's minds and causing them some anxiety.
It's so interesting, isn't it? And I think I suppose I would have thought perhaps that we would see more financial worries coming up during this period, and of course perhaps the true economic impact of this COVID period has not yet started to impact people's lives directly so much. But again, it'll be important to study it for the remainder of the year, how the financial worries and the worries directly related to COVID-19 are interacting with one another and affecting the nature of their presentation. We also have been studying, aside from the AI-related analysis of the therapy and assessment language, the sort of clinical phenotype presentation of the patients for depression-related symptoms and also anxiety. Let's look at the depression symptoms. So what are we looking at here on the slide, Anna?
So here we are looking at intensity of 3 specific depressive symptoms. For 2019, the line's in red, and 2020, the line in blue. So what we're seeing is a relative change in symptoms year on year, if that makes sense, across time. So what we are seeing is that for the first month or so of the year, 2020 is very much the same as 2019. So people's symptoms are very much the same as they had been last year. But as lockdown started and the situation with COVID becomes more serious, what we are seeing is a decrease in some of the depressive symptoms that people are experiencing. So in 2020, it seems that people are feeling less tired. They have lower, they have fewer symptoms of low self-esteem, so feeling bad or feeling like a failure. And they also show a reduction in thoughts of suicidal ideation and self-harm. And this is really interesting because we were sort of expecting that lockdown and COVID would be associated with an increase in depression, having people having to stay in, but actually it seems to alleviate some of these depressive symptoms. And looking at the previous literature, particularly around suicide, this is something that makes sense. We have seen, for example, during the First and Second World War, there was a decrease in the suicide rates, but also for positive events like the 1998 World Cup, we also saw a reduction in the suicide rates. So it seems that events, both positive and negative, that bring communities together for a greater cause, seem to lead to these reductions in thoughts of suicide. But this comes with a warning, because after these events have passed, the literature also shows us that suicide rates then increase, and particularly in cases of economic recession. So there's some sign of some good things that have come with COVID, but also a warning sign for the future.
Yeah, it feels incredibly important potentially this, because we need to look out for those things that might kind of be in the post on their way to us as this situation evolves and we get some kind of rebound effect maybe from that attenuation. I think, it's also perhaps important to say, of course, these are just patients that have taken the step to seek help and are presenting to our service, and of course there may be many more people that are experiencing something very different to this in their particular COVID experience, but at least some slightly counterintuitive positive impact on the clinical presentation during this period, and we really need to understand, don't we, why people are feeling less tired or having more, they're feeling that they've got more energy, and why they feel less like a failure. Is that about they're not so much comparing themselves to others and so on. So there's lots of analysis that we can do going forward to get to the root cause of those changes. So let's look, turn our attention to anxiety symptoms, and it's a very striking graph here on the screen. Talk us through it, Anna.
Yeah, so as opposed to depression, where we see an alleviation of depressive symptoms as a result of lockdown, we also see an increase in some anxiety symptoms. And this particular graph shows us, again, the comparison between 2019 and 2020 in terms of symptom severity, specifically for feelings around feeling as if something awful might happen. And what we see here is that we see a sharp increase on the blue line for 2020 relative to 2019, immediately following lockdown and around lockdown starting. So it seems that as lockdown started, people started feeling as if something awful might happen. And this makes sense because there's various different worries that are playing in people's minds at the time. It's not only the number of cases increasing, but you also start having problems in getting food and essential supplies. You also have children having to be homeschooled and having to work from home at the same time. So, and not being able to see your family and so on. So there are different types of worries around this time that sort of made people feel as if something really bad is actually going to happen. And as lockdown continued, these worries and these feelings seem to have returned to normal levels. So it was interesting to see that it was a very sort of sharp but time constrained increase in worries.
Yeah, it seems relatively short-lived, doesn't it? This deviation, this feeling that something really bad is imminent, and what was going through my mind as I was looking at these data is, what happens next again when we come through this period and we start to put the broader relief from the lockdown regulations. Does that make people feel more exposed, or are they feeling safe as they return to a somewhat more normal way of being? So again, it's interesting to see it now. It's good to see its return to the previous year's pattern, but the question remains, what will we see later in this year as we enter the autumn and the winter? These interactions are complex and dynamic, which means they're changing, and it's true to say we don't fully understand this and we need to study it more. I think one example you've mentioned to me about the of a sort of mitigating factor and a complex interaction is the impact of age on how COVID has affected clinical presentation. Perhaps you might talk us through this this data set.
Yes, yeah. So we looked at various demographic factors and how they influence the way people are feeling, because we know that people in different age groups, for example, experience things differently. And what we've seen in terms of age specifically is that the relief of depressive symptoms that we were talking about earlier seems to be experienced to a greater extent in our younger patients. So here in this graph, it shows the symptom severity of 2020 relative to 2019, specifically for feelings of tiredness and low energy. And what we see is that the younger group seem to experience a greater relief in their feelings of tiredness compared to older patients across time during peak lockdown.
It's really, it's a very striking effect, isn't it? And again, critically, these are young adults, the youngest, and I should say we're not treating children and young people, but it's really, I think it's it's fascinating to understand how that interaction is occurring, and what does it tell us about the factors in our lives and the lives of younger adults that are driving these factors that we're seeing alleviated during this just period. So again, as we scrutinize these data more going forward, hopefully we'll get to a causal understanding of what's driving this alleviation of symptoms most markedly in younger populations. So we're moving into a phase of trying to translate these data into insights, and insights into changes in clinical protocols, and continuing education for our clinicians. And we use these data also in case management, so we can help clinicians be equipped with the right information to deal with COVID as it affects their practice. So we're really interested in getting input into these data and collaborating with you guys. So if you have any thoughts on these data, we'd love to hear them. We're all about trying to translate this new information into and making best use of those data. So we're really looking forward to hearing your comments, and also please feel free to reach out to Anna or myself, and we can share the data and explore with you further. If you're interested in learning more about the research work that we're doing at IESO, you can check out some of our recent papers. They detail clinical effectiveness, how we're using AI. We're looking at spending a lot of time thinking about patient segmentation and personalized or better targeted treatment approaches. And you can also check out my TED talk that I gave pre-lockdown, which details some of the more advanced work on clinical phenotyping and application of AI. So Anna, thanks very much for joining the discussion today. We're really looking forward to your input, and thank you very much.